Welcome to tonight's presentation of interviewing at medical schools. We are so glad to have you here, and we certainly understand and appreciate that you've got lots of other things you could have been doing, whether that is preparing for the MCATs or starting to write your secondary essays. We're just glad you're here with us. I think we're going to have a fun presentation tonight. It's really going to be a round table where we are going to sit around and talk about the interviewing process. I am joined tonight by Dr. James Wasco, who is a fellow admissions consultant along with myself here at Kaplan, and then by two of our colleagues, Aishwarya and Henry, who are both currently medical students. And so they're going to be reflecting upon what really happened on their side of the interviewing table, while Jim and I talk about what's happened on our side of the table. So before we get started, let me introduce everyone. Henry, why don't you start? Might want to unmute your...
This happened last time I did that too. I'm not great with this whole Zoom thing. So I'm Henry, who's a technical Luddite, and I apologize for that. But I'm a rising third-year medical student at the University of Connecticut School of Medicine. I went to Fordham University as an undergrad, where I majored in history and political science with ambitions for law school. And then in my early 20s, decided to completely throw that on its head and flip the table and throw out my bachelor's degree and start over and pursue medical school, which I did. And then I took the MCAT. I applied to med school. I didn't get in. I retook the MCAT, this time with Kaplan course, and reapplied to med school. And so second time was the charm for me. So I have both losing scenarios for interviews and winning scenarios for interviews. So feel free to scratch that wound and ask about either.
Great. Aishwarya?
Hi, I am currently a third-year medical student, although the transition was kind of iffy because of COVID, so I still feel a little secondary. And I'm currently a student at the Yale School of Medicine. So both Henry and I are representing Connecticut right now. Like Henry, my undergrad wasn't actually like medicine-based because I was a chemical engineering undergrad, but I kind of always had the plan of going to medical school. I just found the way that engineers think to be very interesting. And I only did one round of the MCAT and applications, but I did kind of have like a harrowing time of it. And I'm kind of the person who didn't get any interview invites until December, but I'm here to say that like, even though everyone looks at you with the pitying look, it doesn't mean that it's over until it's over.
In this case, it wasn't over.
Yeah, exactly.
And Jim, how about you?
Oh, okay. Thanks, Maria. And welcome, everyone. My name is Jim Wasco, and I'm a recently retired emergency department physician. I went to undergraduate and medical school at the University of Michigan. I did a year of residency in Chicago at what is now Rush Medical Center, then went in the Air Force for a couple of years, and then finished residency in Boston at the Brigham. It was Peter Ben Brigham Hospital at that time, currently Brigham and Women's Hospital. So I stayed practicing in Boston and retired from a place called the Leahy Hospital and Medical Center, or Leahy Clinic, which is a teaching hospital for the Tufts Medical School. And I spent my career there, really the last 25 years as an emergency department physician. For 15 years, I've been on the medical school admissions office, doing interviews and also reviewing applications at the University of Michigan. And 7 years ago, I started a position in the athletic department at Michigan, counseling student athletes who are going into medicine. So I've had lots of experience in interviews, talking with people who've had interviews and all that, and I'm happy to share stories and whatever else we can do.
Great. And my name, for those of you who don't know me, is Maria Loftus. I am the former assistant dean at the University of California, San Diego School of Medicine. So I'm the only person representing the West Coast tonight. I was in that position for about 20 years. And during that time, I represented medical schools both in the Western region, as well as chaired the National Committee on Admissions for the Association of American Medical Colleges. And while doing that, I got to work with admissions committees across the country, which was incredibly enlightening to me, because what you may not know is that medical schools don't share with each other what we do. And so you just kind of assume when you're at a medical school that whatever you do is what everybody else does. And so being chair of the committee, really I found out that, well, certainly there are commonalities. There's also a lot of differences between what we think is important and how we go about making those assessments. About 2 years ago now, I retired, and now I get to work with clients full-time here at Kaplan, helping them prepare for medical school, to understand the process, to put their best foot forward, and to be successful. I've gotten to share in so many successes as our clients go on to medical school, and that is, of course, the best part of the job.
Yay.
Yes.
And Maria and I have been working together for almost a year and a half now, Maria, right?
Yes, that's right.
Kaplan about a year and a half ago, and we
Yeah.
have shared lots of stories and lots of experiences. So.
And now we're going to share them with you this evening.
Yeah.
So I'm going to start with Jim, just asking, so why do medical schools interview? I know at one time they didn't. They would just go straight off the application and accept people. So why go to all the, labor on our part and expense on the applicant's parts to make them go through an interview?
Well, there are several reasons, and the first of which, and most important of which, is to see if you are the person behind the application. I mean, everybody completes the long application for medical school, which is 30 plus pages long when you consider the demographics and the references and the grades and all of that stuff, and what you write about your experiences and your personal statement, which is an indication to us of why you're interested in medical school. But medicine is a science, of course, but it's also a communications field. And we need to make sure that the people who are applying to us are what they say on the application. And so this is the very interesting part of the whole process, where we actually get to sit down and discuss with people their passion for medicine, why they want to go into it, what was the spark that got them started to medicine, what experiences have they had in order to galvanize their experience and to make them want to be a physician. Now, of course, they can say all these things in writing, but it's very different when you have somebody in person and you're able to communicate with them. And the bottom line is we get to see introspection. We get to see how they communicate, how they respond to us, how engaging they are. Are they nervous? Are they not nervous? What are their plans and what are their goals? And in the end, I look at them and say, is this a person I would consider going to see if I were in need of a doctor, or if I were hiring for my practice or interviewing for the hospital? Is this a person that I would want to bring in? It's a long, convoluted thing, but there are many reasons, obviously.
Yeah, and I think you covered it well. So now I'd like to ask Henry and Aishwarya, are you glad that you had to go through interviews? And what did you learn about the process, the schools? Did it help you make decisions about where you wanted to go?
I enjoyed interviewing. I like talking to people in general. And I remember like my Yale interview, it was with a current medical student and then with a faculty member. And with my current medical student, he started off, I just briefly asked him about his research. And I know it was something cancer related, and it was something that involved virus vectors. And I don't remember exactly what it is anymore, but I thought it was so cool. And we spent 90% of that interview talking about his research, and he was explaining it to me and drawing me pictures. And I was like, I don't know how much he learned about me, to be frank, but I love that this person is so excited. And Yale offers you a fifth year if you choose to take it to do research. And I was like, I love that he's been taking advantage of that. And it's not like a task for him. He really is enjoying it. And he also is here interviewing me, which is pretty cool. So that was one of the things that made me like Yale, that they just seem very humanized and their students were willing to take time. And conversely, I interviewed at a different school with a psychiatrist, no less, which I think makes this story worse. But they asked me, are you interested in a specific field right now? And then the school I interviewed at was, it was a school that I had connections to as well. And I had shadowed someone at that school. And I was like, yeah, I really enjoyed shadowing this person in this, this field, and I like anesthesia. And he was like, oh, that's gonna be a great specialty for you. And I was like, why? I figured he was gonna be you're bubbly, you're easy to talk, whatever. He's like, oh, because women really find it good for balancing work and school. And I was like,
oh my God.
Oh no. And I was like, if this is like, one, the psychiatrist, and two, like, this is the face the school is putting forward to interview prospective students, like, that's not okay.
No, it wasn't okay. Henry?
I also enjoyed the interview process. I think meeting people and having an affinity for that is something that you definitely want to bring to the field in general. So the interview process, I think, really should be fun. I kept reminding myself, obviously you get a little bit nervous and you have to remind yourself of some things. And one of them is that if they're interviewing you, there's kind of some interest there. And so I kind of joked with myself and I was like, all right, it's kind of like a date. Like I got to make sure I look good. Like I got to say the right things, but like also like be casual and be myself, but not too much. And I would say that interviews went significantly better than a first date ever does, which is fantastic news, right? But it really can be an enjoyable process. And I think if you're willing to engage with folks while you're on the interview trail and why speak to the other people who are interviewing, because that gives you a sense of who they're interviewing to be part of their school community, right? So even your co-applicants give you a feel for who the school is interested in. Students that you meet there give you a good feel for what their environment of the school is there. And I do think that counts for a lot. I mean, UConn was one of my top 3 schools, and I interviewed at all 3 of my top 3 schools, and one of them I didn't get into. And so between the other 2, the visit really told you a lot. It was a lot, one school was very, very social, which was UConn, and the other school, it was very much kind of you're on your own. That was a big decision maker for me. At one school, people seemed to know their peers, go out with their peers when they had the opportunities, like hang out with their peers. They knew who they were, they knew about them. The other school, that wasn't really the case. And that was a big deal for me. And so it's definitely an enjoyable process. You're there to be your best you, but you're also there to learn about them. And it's very give and take. And if you really embrace that, I think you'll get a lot out of the experience. And I think you'll enjoy it and you'll walk away with it with positive opinions.
Henry, I'd like to mention something picking up on what you said very early in your talk here, that there's some nervousness there. And, I always look at it from this point of view, and the people who are listening to us should understand this too, that most medical schools get several thousand applications, and they can't really interview several thousand people. So medical schools wind up interviewing a few hundred people. And so the few hundred people that are selected have already been prejudged or pre-screened by the medical school in question to think that this person seems like they would fit in with the character of the medical school that we have, with the kind of student body that we have, and with the kind of teaching structure that we have now. So you've already passed that, 1 out of 20 kind of screen. And so what you're doing there is you're now seeing if you are really who you say you are. And, the comfort, the familiarity, you're evaluating the school and we're evaluating you. It's sort of a combination effort that's going on.
A lot of the questions that we have coming in have to do with the fact that everyone's anticipating that interviews are at least going to start this year online. And so to the extent that you have any insight as to what your medical school might do regarding an online video, are they going to try to replicate what they've done before? Are they going to give students the opportunity to meet with medical students, give the applicants the opportunity to meet with medical students? Do you have any insight as to what's coming?
I personally don't. We still have access to the second floor, of which is our admissions floor, because we use their printer. And that floor has been empty for the last few weeks. So I feel like online is probably a viable option right now. I'm not quite sure that they're going to be coming back in over the next month or so. I know Connecticut's been having, the rate of infection has been decreasing, but I still feel like it's not worth the risk. So I'm guessing that an interview that's virtual is going to be a thing, especially because of travel restrictions too. Just because people would have to fly here depending on where they're coming from and potentially quarantine for 2 weeks, which is going to be a big challenge.
I actually had dinner with the chair of the committee at our school on Tuesday for a separate reason. And let me just take a quick aside. It was amazing to actually be out at a restaurant, even though it was 6 feet apart. It was just very nice to be out. The little things, right? And what he expressed to me is that at least what we're going to be doing here at UConn is it's going to be pretty much exactly what it was before, except that it will be online and be done virtually. So at least at our school, we had a student interview and a faculty interview, and they're still going to do that. One thing that they're struggling with is how they're going to, interview day was also about like bringing you on a tour and showing you around. They're struggling with how exactly they're going to manage that. And I know that they're trying to avoid just having it be kind of a slideshow of the school with a voiceover, kind of walking them through it. They're trying to think of a creative way to do that. So I think that says two things. One, I don't think interview day online is going to be terribly different in terms of what they're asking you and how you're interacting with folks, other than the fact that you'll have to remember to look at the camera instead of at the screen.
And you don't need their pants.
Right. Yeah. I mean, I would still wear them like just in case, but for that one, you could put on the suit pants, no belt. But I think the other big thing that conversation kind of demonstrated to me for you all to keep in mind also is that they're also trying to think of ways to deliver their school to you in a new creative way. And so I would take some of the pressure off yourself. I think everyone understands that virtual is going to be a little weird and a little, that we're not going to, it's not exactly going to be the same. We're all humans here. And I think even connecting with someone on that fact can make you very humanizing and kind of acknowledging the elephant in the room. I didn't do any virtual interviews. I can imagine if I were going to do it, I would probably make a kind of a cheeky joke about it because that's just kind of who I am. I can't help myself. But I would acknowledge it, I think, to yourself, if nothing else, that I would not anticipate different questions. I would not anticipate them treating you any differently. It's just going to be from the comfort of home. And you're going to have to take other little things into account, like not just how you look, but how, like, what behind you looks like. You're going to want to try to account for some of those things. But beyond that, it doesn't feel like at our school they're doing it much differently.
Great. How about you, Jim? Do you know what Michigan's going to be doing?
Our plan right now is to start with virtual interviews, with the possible exception of those people who are local to Ann Arbor. And we may offer them the opportunity to come in. The advantage, obviously, for the student is that it's less costly. You don't have the airfare, you don't have the long drive. It's less intrusion in your time if you're a current student or you're working on a research project or have some other issues going on. So we can learn much the same from you. We're going to have your application in front of us when we interview. We'll select the same kind of questions, as Henry said, that we would have asked before. And we're going to expect that you will ask the same questions of us. We're still going to want to know why you chose our school, why you want to be a physician, and all of the other supplemental questions that we ask. The downside, of course, is you don't have the opportunity to physically walk through the corridors and to see what the institution looks like and to see what the community looks like and see the relationship of the school to the community. At our school, the students normally come in the Friday night before, and there's a social gathering on Friday night with students. That's in a pizza place where people can feel free to talk about anything that they want and learn about the school from the students. In some cases, the students are actually boarded up with a current medical student, so they really get a lot of attention from the students. Now, obviously, we can't do that now. So our plan is to try to develop a group chat kind of thing where students can meet other medical students and find out some of the details that only the students can share. It's a moving target, as we've said so many times before. We'll just have to see what happens a month from now or a month and a half from now, but our plan now is to do it virtually. And frankly, Maria, you and I have been dealing with Kaplan students virtually for the last year and a half, and I find it very effective. I mean, we can still look for eye contact. We can still look for whether somebody is fidgeting in the background. We can still see nervousness. We can accomplish a lot. It's not quite as effective, but we're going to do the best job we can.
It's also really good preparation for telehealth because that's something that a lot of doctors' offices are doing. Like, I'm in primary care and the whole afternoon is dedicated for telehealth purposes. So establishing that you, like you said, can make eye contact when you're talking to a patient, even though their camera or your camera window is lower on the screen, is a really good skill. And establishing that you can establish rapport even if you're not in person, is something that's going to help you stand out.
So I hope one of the things that our audience is hearing is just how important the medical schools take their responsibility, but also how much we're kind of nervous about how we're going to be doing this. We're making it up as we go along, and we very much see the interview process, the interview day, as being a recruitment opportunity for us. And when you're sitting on the other side of the interview table as the applicant, I know you probably think that we have all the power. And of course, we're trying to impress you. And so right now we are struggling with, how are we going to do that? How are we going to convince you that our school is the best for you? Because as Jim said, the fact that we're interviewing you means we are interested in you. You have passed all of our preliminary hurdles. You're someone that we want. So we do take the recruitment aspect of the interview day very seriously. Based on Jim's and my experience with working with our clients over Zoom for the past year and a half, and certainly doing mock interviews, we both do a lot of interview prep. I will mention a couple of things that I am always surprised that a client who's, paying to go through this experience and to get the feedback, things that they may not think about. One is just the lighting. You want to make sure that your interviewer is going to be able to see you and your facial expressions, because as human beings, that's really important to us. We read those nonverbal cues. Whether we're reading them accurately or not is a whole other discussion, but the fact is, as humans, that's important. And so if you've got light, the windows behind you, they're not going to be able to see your facial expressions because you get blacked out from the bright light. Conversely, you don't want to be in a dim room. If the sun happens to be setting, make sure that you've got the light on. You don't want the camera looking up your nose. That's not a good look for anyone, so make sure of that. Henry mentioned that you do want to pay attention to what's going on in the background. And it's not just that your setting looks as professional as possible. Ideally, I recognize that you might be filming in your bedroom, but we shouldn't be seeing your bed. And we shouldn't be seeing dirty clothes or really personal items. Try to clean up, put stuff away. You don't want your roommate walking through the background. Hopefully, you don't have major construction taking place next door to you. And if you do, I'd suggest you film someplace else. And then lastly, something that happens way more often than I would expect is that people aren't charging their computer at the time they're on camera with me, that we're having our mock interview session, and all of a sudden their computer goes down. You don't want that happening during the middle of your interview.
My goodness, I hope
Yeah, and I can appreciate that sometimes a internet connection is unstable, and that may not be anything that you can do something about, but there's really no excuse for you to run out of power with your computer. So those are just a couple of things that I can say that I have seen working with clients that you just want to make sure are taken care of before. So now let's turn
one more thing, Maria, if I can add.
Sure.
And that's that, when we're doing virtual interviews, just like we're speaking here, we're looking at each other from sort of the chest up. And so there's a tendency for people during interviews to not pay attention to what's going on from the waist down. But you never know what happens. And occasionally I have had interviews of students working with Kaplan and also with university students where they've suddenly had to get up. And then the rest of what they're wearing becomes perfectly obvious. So, this is a professional event that's going on, your interview process. And you need to be as professional as you can, both in your language and in your attitude and in your dress.
Correct.
Brings us back to Henry's wear pants.
Yeah.
All right.
And also, as was mentioned before, you do want to practice actually looking into the camera, wherever your camera is. And I can tell you that for me, that has taken some work, because I am so used to wanting to look whoever's on the other side, whoever's in my computer screen, I want to look them in the eye and see their facial expressions. But if you're the one being interviewed, you do want to identify where your camera is, and as much as possible, be looking at the camera.
One other thing, Maria, and that is that the kind of people who interview you, I think, needs to be discussed a little bit. Sometimes you'll be interviewed by a faculty member. Sometimes you'll be interviewed by an alumnus. In my case, at Michigan, I'm an alumnus interviewer. And in some cases, you'll be interviewed by a student. And there is a tendency for some people to just breathe easily and say, well, I'm going in to see a student now, so that's not going to be a big deal. But sometimes the student is the hardest interview of the group, because the student is interested to see whether you are the kind of person who can fit into this class. And so they're going to be asking you similar questions, but maybe with a different bent to it. So don't assume that a student interviewer is going to be your time off during this.
Or your best friend.
Or your best friend, right.
So Henry and Ashwarya, do you guys interview for your admissions committee?
I want to. I'm currently a third year, so next year will be my fifth year. So as a fifth year student, I'll be able to do that. I think it'd be so much fun.
I chose not to for two reasons primarily. One was I run a group through our school who has a bunch of like pre-meds involved in it who are mostly applying to the school. And between that, my job with Kaplan, felt like I might have a bit of a conflict of interest because I work with them, MCAT students and folks who are applying. So I didn't want to create a conflict of interest. So I tried to avoid that, because it's, you practice what you preach. You tell folks to come in with ethics. I felt like I had to recuse myself. And then the first year when I could have interviewed, also my girlfriend was applying to our school, and I also felt like I just needed to recuse myself in general from just the whole process.
I think that was very wise of you.
Yeah, well, speaking of that, a similar situation goes on with me, because I have, a student group from the athletic department that I counsel for the 4 or 5 years that they are there. And some of them are going to apply to the University of Michigan Medical School. And it's absolutely hands-off for me once their application is completed. I don't communicate with the admissions committee about them. I don't answer questions about them. I have nothing to do with the process once they reach there, because it would be a conflict of interest, as Henry said.
Right. So then let's turn to both the different kinds of interviewing formats, and whether or not you think that they will be taking place, those same different formats will be taking place in the virtual arena, and maybe a few types of the common questions. So let's start with you, Jim.
Well, talking about common questions, first and foremost, I want to know why this person wants to be a doctor. I want to know what passion they have and what they can show me in terms of their interest in medicine. We always say, don't tell me what you want to do, but show me what you want to do. And so I look at the application, I see what strengths they have, I see what experiences they've had, and I read what their comments are about their experiences and also their personal statement, so I can get a sense of what their passion is. But sometimes people are very good writers, and yet they can't express themselves in person. And so the first thing I want to find out is exactly, why is medicine for you? Give me some reasons, let me see your passion. The second is I want to know why you have selected this school. And I want to see how interested they really are. If it happens to be a top 10 school and they've applied to all the top 10 schools, well, that's not enough. I need to say, what is specific that you know about this school? What contact do you have with it? If you don't have a contact, what have you learned about it? through the research you've done on the internet and talking with maybe faculty members who have an association here, how much do you know? And what do you expect out of medical school? Just tell me what you feel you want to do. Beyond that, there's all kinds of intangibles that I'm looking for the whole time. And those are the engagement, the communication style, the passion that they feel, the introspection that they have in order to tell me that this is something that they really want to do. First impressions are really, really very important. I also want to see if they're happy to be there. One of the things that really disturbs me is when someone comes in with a long face and they're about to be interviewed for a place that they really have wanted to go to, and they're talking about a career that they want to get into, and they've got this long face as if, I'm not sure I really want to be here. Well, when I say to you, how you doing today? I expect you to smile at me and say, I'm really happy to be here. This is something that I've looked forward to for a long time. And by the way, that helps to break down the stress of coming in to establish a conversational point. We'll, of course, ask questions about leadership experiences and something to tease out the resilience that people have or the adaptability that they have, their opportunities to overcome challenges that they've faced. I'd like to know a little bit about their family, a little bit about their background. And there's all kinds of questions we can get into, but those are the basic ideas that we approach an interview with.
Okay, before I turn it over to Henry and Ashwarya, I will just say that the type of interview that Jim was just describing is what we think of in the business as kind of the old sort of traditional interview, where the interviewer may have some guidance as to general topics to cover, but otherwise they're allowed to use their own discretion and have a conversation with the applicant. Other schools have moved to a more new type of traditional interview, and it follows in the footsteps of employment and employment law and the types of interviews that typically take place in that arena, which are that they are pre-formatted questions that every applicant is going to be asked. Based upon those responses, the interviewer may have follow-up questions that are very specific to the applicant. And then the third type, which is quite common, it's growing in popularity, is what's called the MMI, which stands for multiple mini interviews. And we're going to talk a little bit more about those in a few moments. But I do envision that all three types, with the exception of maybe some of the MMI subcategories, but the three major types of interviews will translate just fine to the virtual environment. And certainly, with Jim and I, we are prepping our clients when we do interview prep. We're prepping across those three different types of interviews, and it's not a problem for us. So I can't imagine it's going to be a problem for the medical schools. But now I'd like to hear some of those insights.
We call those long form interviews. And for us, they're 30 minutes long.
Great. Thanks.
With a 15-minute break in between. But we also do MMIs too, and we'll talk about those a little bit later.
So turning now to Henry and Ashwarya, I would like to hear some of the lowdown, the good, the bad, the ugly of what happened at your interviews. Can you share with us maybe your hardest question, your most, outrageous moment, your funniest moment, the thing that crystallized for you that you wanted to go to a school or didn't want to go to a school?
I have my toughest question, hands down. I was, the questions that Jim mentioned, I was ready for tell me about yourself. I was ready for why do you want to be a doctor? I was ready for why do you want to be here? Ethical situations, I was like, I practice these, I've got these down packed. Student at UConn asked me, tell me a joke. And I sat there and I was like, I know a lot of jokes, but none of them are appropriate for the setting. And so I'm like running through my brain and I'm saying, okay, you have to find a joke that really is appropriate for the setting. And I told her outright, I was like, listen, I have a bunch of jokes and I have to think of one that's appropriate. So she made a deal with me. She said, think of one by the time I walk you back to the admissions office and you've got yourself a deal. Now, I was able to make her laugh elsewhere in the interview. So I think I had covered myself. I did end up coming up with a joke. I'm not going to tell it because it was awful. But that was definitely the toughest question I had. But that one and same interview, because I'm originally from New York City, she asked me to estimate how many traffic lights I thought there were in Manhattan. And I was off by like 20,
Oh,
which I
that's
almost
not
got it.
bad.
So, because New York City is a grid. So if you know how many streets and avenues there are, you can break it down, do the multiplication. Anyway, really, really nerdy New York geographer. But those were two of the toughest questions I got, and I had them in the same interview. Go figure.
How about you, Aishwarya?
I think that my interviews were pretty standard. I remember one that very much was like she was checking off like boxes. And so she asked me the ethics question. She gave me the ethical scenario and asked me what I would do. And it actually wasn't one that I had prepped for, but I think I have a pretty strong stance on where I stand on a lot of different ethical issues. So I didn't really struggle with that. But that is a thing that I feel like people worry about, answering with the wrong opinion. And I think most interviewers are fine as long as you can just defend your opinion, whether it's one way or the other. But sometimes it's good to have background on your interviewer just to be sure that you're not like hitting a vein. And so she did that. She was like, tell me about a time where you fought with a teammate or had an issue with a teammate. How did you resolve it? So there was the behavioral question. And I think that was just kind of weird for me because I didn't get to see a lot of her personality and the school's personality, although I think it did actually fit the school because it was a very regimented school. You had quizzes every week, you had a test every month, and that kind of made sense. Whereas at Yale, for my faculty interview, he spent 5 minutes, he like grabbed a sheet of paper and started drawing out the admissions process from like when you submit your MCAT to like when the committee meets to decide. And I was just fascinated because no one had ever like explained all the hidden steps before. And he was like, I just want full transparency. Like, great.
I will say sorry, Aishwarya.
I also had one, this is like kind of my favorite one, where I think it was supposed to be a regimented interview, but one of the things that I had gotten very interested in right around that period was this comic that had come out in India about women's menstruation. And I thought it was the greatest thing ever. And I told anyone who would listen about it. So I started talking to her about it and she was like, hold on. And then Googled it. And then we like just deep dove into this comic for about 40 minutes. And I thought that was fabulous because I feel like she really got to know that side of my personality. And I love that she was willing to just be like, this is interesting to you. It's kind of interesting to me. Let's talk about it. So that was really cool.
Great. Any horror stories?
Yes, on the subject of that, I will give you a horror story. I went in to see this young person in the interview room, and he was a 4-point graduate of a school that I won't name. And he was young for his age and had a very impressive list of activities. I introduced myself to him. He introduced himself to me and then said, I'm brilliant, you know. Well,
not as smart as you think.
Yeah, that's an interesting comment to make at a medical school in particular. And so, you know, I quickly thought to myself, what am I going to say to this? And so I asked him, how many people were in the gathering room when you came in? And he said 36. So I said, well, they're all brilliant in one way or another, or they wouldn't be here because in their own way, they are very accomplished people. That didn't end him. He said, not like me. He said, I was a graduate in physics. Physics is not enough of an academic discipline for me. That's why I wanted to go into medicine where there's much more to learn. And I looked at him and said, if I were Stephen Hawking or Albert Einstein talking to you, would you still make that comment that physics is not an academic enough discipline? Well, it went on from there. But that's an example of something that you maybe don't want to do or say. Arrogance is a game changer.
So for our audience member who asked the question of what are the red flags we're looking for, this would be
There's one.
pretty high up there.
There's one.
How about Aishwarya? Henry, do you have any horror stories from your side of the table?
I told you my biggest horror story at the beginning.
Yes.
We did have, this didn't happen to me personally, but one of my friends, her interviewer fell asleep during her interview. And it wasn't like, the interviewer wasn't trying to be impolite or anything. They were really trying to do their best because they had come off of like a 24-hour shift and they had promised to do this interview. So they were really trying to honor their commitments, but like fell asleep. And it worked out fine because my friend kind of had to gently wake her up. She apologized. Like my friend also told the admissions office and they arranged another interview for her. So that's a good rule of thumb. Like if you feel like it didn't go well with your interviewer for a reason like that, or they make a sexist comment, like it helps to go and tell the admissions office because you probably then didn't do well the rest of the interview unless you're a very good actor. Because it's hard to click with someone that makes you uncomfortable. And a lot of schools are willing to give you a second chance if you explain why you would like one.
I totally agree. That is something that I would always give a preamble before the interview days. And that was one of the things that I said to all of our applicants is that please, 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 if anything happens, you know, you're behind closed doors. We don't know what happens unless you tell us. And so if there was ever anything that was inappropriate or made the applicant feel that they had not been treated fairly in any way, we wanted to know about it. But I will turn that, you know, conversely and say that when we get back to live in-person interviews and you're visiting a school, and, you know, hopefully that will happen this year. So some of you may be going to live interviews. There are no off-the-record comments. There are no off-the-record interactions with people. That we would also encourage, you know, the janitorial staff, the bus driver who took you to between hospitals, that if an applicant acted inappropriately or demeaning to them, we wanted to hear about it. Henry, did you have anything to add?
I think I had two moments. I wouldn't say they were nightmares. Well, one of them was maybe a nightmare scenario. One of them actually, I think, kept me out of this, the only school I was rejected post-interview. And that was when we came in, we had to log back into our secondary application portal in order to do the MMI process. And I use a password service. I don't know any of my passwords. I use LastPass because it gives me extra security. So I was like, oh, I don't know what the password is. So, you know, at that time, it was fine. I pulled out my phone, I wrote down the code, and they said to me, keep the code with you because you're going to need it later on in the day. It was in my suit breast pocket and somehow managed to escape my suit breast pocket. And so when it came time for me to need that password in the MMI, didn't have it. And that was really bad. I knew in that moment, it was the best, like it was like a top 10 school. I was like, I'm probably cooked here. And I was, and that might be the reason. That was an unforced error on my part. The other big one I had was not so much a nightmare scenario, but a very challenging moment. I was interviewing at a school in the Midwest, and it has a very notable hospital with it. And they had one side of the city was where like the infamous hospital is, that's like got the great reputation. And the other half of the city was largely underserved. And in the underserved community is where they had in the underserved communities where they had like the grand institution, and in the wealthier side of town was where the Medicaid hospital was. And I challenged my interviewer and I was like, why is your catch-all hospital across the city from the people who need it? And I did that because I had already been accepted to another school that I wanted to go to. So I felt kind of safe doing that. And two, it's because for me, that's a topic, like I'm pursuing an MPH, like that's a topic that meant a lot to me. And I wanted to see that the school had a very serious commitment to working with the populations I wanted to work with. And it was evident that they didn't. And that made the rest of the interview painstaking, because at that point, I knew I didn't want to be there. And at that point, the interviewer knew that I didn't want to be there. And like the both of us could have just shaken hands at that point and been done. We both knew it. And so, unless, I would say don't do that unless you're already accepted at a school that you want to go to. That was the only reason I took that risk.
But, you know, I think that you were honoring your own values, and that's good. But as you said, you wouldn't want to do that until you had an acceptance already in hand.
It's
So-
a legitimate question though, Maria.
Yes, that's why I said I was
Legitimate
happy.
question.
Yeah,
I mean, particularly with the United States changing its demographics, you know, by the year, it's important for us to understand what people's commitment to social justice is and to dealing with marginalized populations.
absolutely.
So those are fair questions to ask.
Absolutely. So let's turn to the MMI and talk a little bit about the MMI, because it is so different than any interview experience that you have probably had to date. So Jim, why don't you walk us through the MMIs?
All right. Well, let me say, first of all, that out of the 160 some medical schools, as of earlier this year, 46 schools use the MMI and the rest did not. But 15 of those schools have sort of a hybrid interview process. And that means that they use MMIs and traditional long form interviews. So basically the MMI is a short scenario, a short encounter that is targeted to a particular problem or a particular scenario. And there are basically the way an MMI works is that the whole encounter is about 10 minutes long, give or take a minute or two. And the first minute is spent outside the door of the interview room where you're presented with a scenario that tells what you're going to be talking about or what the interview consists of. Then you go into the room. There usually aren't introductions that take place, but you get right to the point of it. You have a dealing with the interviewer that might be 6 or 7 minutes long. And then there's a minute or so to break off it, and then a couple of minutes to get to the next setting. So that's basically it. It's a 10-minute process for each one. And there are a few different types of MMIs. One would be a policy question, which relates to something that might be contemporary issue. What do you feel about access to healthcare? That would be a simple one. Or what do you feel about the insurance issues in the United States? That would be another one. But that kind of thing, public health related issues. Another one might be a role play scenario. And this is where you are told that you're going to play a particular role and the interviewer will play another role. So let's say, as an example, you are a friend of a person who just got into a motor vehicle accident, having been drinking and driving. And you are going into the emergency department where you meet your best friend who is not badly injured, but has been cleared and is ready to go home. But you have the conversation with them about drinking and driving. And so the interviewer will make some points and you'll make some points, and that's sort of the whole process. Then there are teamwork stations, which usually involve an interviewer who's an observer and then two people. And they're usually facing opposite from each other. In some schools, they may use a Lego device that has been put together. And then the other person has the pieces not put together. And the individual who has the pieces put together needs to explain to the other one how to do it. And so it's sort of a teamwork kind of a venture that can be done with knots, or it can be done with drawing a geometric figure. In some cases, and this is not common, but in some schools, they will use a writing or typing scenario where they'll ask you a question and then ask you to type the answer to it rather than give a verbal answer to it. That isn't as common as some of the other ones. And then there are some personal questions. Tell me about an ethical dilemma that you've been through, or tell me about, your greatest strength or your greatest weakness. In general, you, the interviewee, are the leader of this scenario, and you have to give what's going on. You have to direct the conversation. And what's happening is the interviewer is making notes, is deciding how you answer these questions. In general, there is no right or wrong answer to any of these. They just are looking to see what your thought process is and how you defend what you're saying. So that's basically the MMI type of format. There are some quirky ones too, from what I've heard. Somebody will ask you, what is a fun fact about yourself and describe it or something like that. So
I will add a couple of comments. There are schools in which the interviewer says nothing. You are the only one speaking for the entire time. And I had a client late last year who told me they had just completed an MMI in which there wasn't even a person in the room. It was just a camera and they spoke to the video camera.
Oh, wow.
And I can imagine that that would be a little disconcerting. But so just know that, again, there is a spectrum of how schools conduct their MMIs. To Jim's point, yes, correct. There usually is not an answer that they're expecting you to get to. And the scenarios that you're presented with may be either lacking in detail, that it's a single sentence, or it may be a paragraph and it's filled with extraneous information. And in either case, if there is for every MMI some critical analysis involved, that you are able to share with the interviewer what you would want to know, what you think is important. You are not expected to have been through this scenario ever in your life, because to the extent that it represents what it means to be a doctor, as a doctor, you won't have all of the information ever on your patient. And you do have to pull upon your own history and background and experiences to problem solve this particular situation. And so they do want to hear you talk out loud about things that you would think about, experiences that you've had that you might pull forward, to help you figure out how to move forward. And to that extent, and this is going to be a gross generalization that I'm going to give here. So I'm saying that up front. In general, women tend to do a little bit better right off the bat with an MMI, because in our culture, we're much more comfortable with talking out loud, whereas oftentimes men get right to the point, and so they've only talked for 30 seconds and they skip right to, well, this is the obvious answer to this problem, without expanding on your thought process. So the thought process went on in your head, but it didn't necessarily come out your mouth. And they want to hear it, because they can't guess what's going on in your head. So if you know that you tend to be someone who is more succinct in your speech, again, you could be having all these thoughts in your head, but what comes out of your mouth is very crisp, succinct, directly bottom line. You might want to practice MMIs, because they're going to want to hear more than just your bottom line answer.
Well, and you've only got a few minutes, so you have to get to the point pretty quickly. But basically what we're looking at is judgment. How quickly can you think on the fly? And we can learn a lot from your body reactions, the comfort that you have with this, the approach that you take to it, the reasoning process that goes on behind it. Don't expect the interviewer to nod their head or shake their head or indicate any sort of pleasure or displeasure with what you're saying. And that jars a lot of people, because in a conversation between two people, usually there's some interaction and you can tell, does this person get me or get what I'm saying or not? You won't get that in most cases.
Right. So Henry, I think you had mentioned that you did have MMI as one of your interview experiences, right?
Did.
And did you enjoy the experience?
Well, first off, I'm pretty terrified at how accurately you and Jim described my MMI experience without us having discussed it prior to this event. So first off, I'm not just somebody who gets straight to the point. I'm a New Yorker who gets straight to the point. So I guess we're lucky I didn't just say, yes, I enjoyed it and ask you to move on. So, and actually that was something I struggled with. Like one particular scenario came into mind. Mine was pretty much as described here. I would say we had, I did one MMI. There were two kind of traditional long form interviews as part of it, but they were only 15 minutes long. There were a couple of ethical questions. There were two stations where I sat back to back and had to, describe and work with a teammate. There was one part that was written that we had to do as well. And so it was pretty much exactly as described here. I'm sure, like, as you mentioned, there are nuanced differences. One quick point that I'd written down: if you do an MMI and you're in person and they ask you to speak into a camera, I'd seriously consider whether or not you want to go attend that school. But that's another point. But what's interesting is I felt, especially now seeing patients, it was, I don't know if they're intentionally assessing how well you can go from one room and address one issue to move to another room and address an entirely different issue and move to another room and address another entirely different issue. If that's intentional, because that's what clinical time feels like. Yeah. There are actually moments where that's exactly what clinical time feels like, because you walk into one patient and it's like, all right, diabetes maintenance, just make sure everything's going normal, re-up their meds, nothing's changed, keep them out the door. The next patient comes in, is like, my shoulder hurts. Why? I got kicked in the shoulder. Well, okay, now we need to discuss this. And next one is I just lost my insurance. And so it mirrors that in some ways, which to their credit. But it was exactly as described. Overall, I would say it was enjoyable. I think if I could give one piece of advice for the MMI, I think it would be be clear on the instructions and know what's being expected of you, so that's just not like, listen, pay attention, read the prompts, like don't neglect that stuff. Between each session, take a deep breath. You need to reset between each of them, no matter how poorly you think the last one went. To Jim's point, I don't know where they found these poker players to do this and not let me know at all about how it was actually going. But from my understanding, some of them, because of that, you might start feeling like it didn't go well, or you might feel like the last one went great, and neither one of those might be true. So between each session, you really need to just reset and be like, no matter what I felt of that, whether it was good or bad, I have this prompt in front of me. It's time for me to address this one and do my best on this one right now. And you have to have a really short-term memory. You need to get that stuff out of there because it is one to the next, to the next, to the next. I haven't done an emergency medicine rotation, but Jim, I'm sure, like in the emergency department, sometimes you'll have a really traumatic case, and then 2 or 3 patients down the line is a benign headache. Absolutely. And you have to block out the one case from before to come into this one. So I would really encourage that. I think resetting in between was something I didn't do very well. I brought the more challenging one with me, which happened up front. I brought that with me in the next subsequent few interview rooms. And what happened was it picked at my character. I am a very direct New Yorker. And so when I didn't like how that last one went, that found its way into the next one in a way that I think probably kept me out of that school. And so that would be my advice on that. Take the prompt seriously, know your instructions, and take the moment to reset.
To your point too, I think that there's an argument for being too succinct, but there's also the argument for being too meandering. You want to show your thought process, but you also want to show that you're making judgments and getting rid of them and not saying everything. Like, you as a medical student, you're going to be explaining what you think your patient has to your attending. You're going to be backing that up with why you think that. But like, if someone comes in with pain in their finger, you're not going to start talking through lungs, because your attending's going to be like, stop, leave. And so during your MMI, you want to do the same approach. You want them to understand that, yes, I'm considering this and I'm thinking about it rationally, but also you want to keep focused. You don't want to keep monologuing.
So we're almost out of time, but I do have one last question for both Aishwarya and Henry. What advice do you have for people in preparing for their interviews?
I've got mine. You can go first if you've got one.
Or... Okay.
You go first.
So I think it's very helpful to have bullet points for the common questions. So know why you want to be a doctor, right? Like, that's a really obvious one. And don't be parroting what you said in your personal statement, because if you're doing that, you're not giving them anything new. So have like 3 or 4 reasons that you can talk about, but don't know exactly what you're going to talk about with relation to them. So for me, I like interacting with people. I like explaining things to people in a way that they understand. And that was kind of what I went into my interview with. And like, Similarly, it's not important to know everything about every current event, but it's likely they could ask you about one. So pick two, become familiar with them. Like, have a book that you enjoy reading that you can discuss. Like, you don't need to be an expert in everything, but it helps to have one thing in a couple of different fields that if you're called upon, you can kind of steer the conversation to.
Thank you. And Henry?
I would say I had, for every interview, I said, here are 5 things that if they don't come up in the interview, I really want to make sure they come out. Most of them were things that would come out naturally, but one of them might not come out in the natural flow of conversation. So I wanted to try to get that in there because it was something that I thought made me stand out. But it really speaks to a bigger point, which is know yourself. And I don't just mean know your strengths and weaknesses. I mean, know who you are as a person, your philosophy on life. Have a sense. I mean, Jim mentioned introspection a couple of times. And I think really taking time and reflecting on who you are well before you ever walk in the interview will position you not just to do better in the interview, but I think to just overall do better in this field. There's a reason why they want folks who can be introspective and know who they are. Yeah. And it's because at least in my experience in medical, it can be challenging. And I had family members get sick during medical school. And so to not be introspective, to not be able to ground yourself and fall back on some individual philosophy and some confidence of who you are makes the path a lot more difficult. And that's really why they're looking for that, in my opinion. And so I would just say, really know yourself. Take some time to make yourself as well-rounded as possible, to really examine who you are. And that way, when you walk in that day, you know who you're presenting because you know full well who you are. And if you're happy with you, it'll be much easier for other folks to be that way as well. And I think generally speaking, that will benefit you in life, not just in your med school interview. So it's well worth the time spent 5 minutes at night each night thinking about it. That would be my advice.
Great, thank you. And Jim, one last question for you. From your perspective as an interviewer, do you have a favorite kind of question for an applicant to ask you? And do you have one that just kind of annoys the heck out of you?
No. The answer to that is no. That it's different for every client, or it's different for every applicant that I see. I will say one thing though, and that is something that does annoy me a little bit. And Henry mentioned having some points that you want to bring out that are strong points that you want people to understand. It's a good idea to try to get those in, but also you need to pay attention to the questions that the interviewer is asking you. And don't make it like a televised political debate where a question is asked of somebody and then they ignore that question and begin talking about something else. Because we are asking questions for a particular reason. We're trying to tease out from you, what we feel, we want to say. And so that's my best advice, I think, at this point.
And I will just add that the questions that annoyed me were questions that were easily found on our website.
Oh, yeah.
Yeah. That said to me, either you just didn't care, yeah, or you were lazy, and it's amazing how many times people ask you questions that are so easy, like, when do students first start seeing patients? Well, every school's pretty upfront and proud about when that clinical experience happens. And so make sure it's not something that you can easily have found, and also make sure it's a real question. It's something you really want to know. Otherwise, it's a missed opportunity on your part.
And this is your opportunity, Maria, to ask a question that really has maybe been not troubling you, but really concerned with you about that particular school. And here you have in front of you a representative of that school who can really shed some light on the inner workings of the school and what it's like to be a medical student there and what the goal and mission statement of that school is.
Absolutely.
Most people, I've almost always been genuinely interested in how they found their way to wherever we were. So as a student, asking, why did you choose this school, or what did you love about this, is always a great question to ask. And similarly to an attending, like what brought you to this place specifically? Was it your family lives here, or like they had a good school district, or just whatever brought you here? Was it the hospital itself? Because you learn a lot about the school, the surrounding area that way. And it also kind of makes your interviewers feel like you're humanizing them because you care about them.
Well, we've gone well over time, and I hope I know it's because I've had a lot of fun, and I hope our panelists have had a lot of fun. And of course, I hope you watching us tonight have both enjoyed and learned and had your questions answered. If you haven't, I'm sure you can talk to your MCAT TA, or of course contact us, and we'd be happy to get those questions answered. But in the meantime, we wish you a good night and a successful journey to medical school. Thank you.
Bye-bye all.